All right, this is a somewhat rapid review of the trigeminal nerve, sort of as a whole, and then specifically piece by piece of each of the three branches.
Okay, here comes my stab at the trigeminal nerve. So the trigeminal ganglion is the basis of the beginning of this entire nerve. You've got three branches coming off: V1 ophthalmic, V2 maxillary, and V3 mandibular. So you already know that the V1 ends up going through the superior orbital fissure, the V2 goes through foramen rotundum, and the V3 goes through foramen ovale. But now let's talk about what they do. V1 and V2 are sensory only. V3 is sensory and motor. We're going to go into the V1 path first. So the first thing it does when it leaves the ganglion is V1 gives off the recurrent meningeal nerve, which sends sensation to tentorium cerebelli and other dura posteriorly. And then that nerve continues on and branches into three branches that go through the superior orbital fissure: the nasociliary, the frontal, and the lacrimal. NFL from medial to lateral. So with NFL, it gets more branches to less branches as you continue. So the nasociliary has 4 branches. The long ciliary, the anterior ethmoid, the posterior ethmoid, and the inferior trochlear. The long ciliary is actually to the eyeball. The anterior ethmoid supplies the anterior dura, the mucosa of the anterior ethmoid air cells, the frontal sinus, and the anterior nasal canal or cavity. And then the posterior ethmoid does the mucosa of posterior ethmoid air cells and the sphenoid sinus. Inferior trochlear does the skin and conjunctiva and the lacrimal sinus. So that's what the nasociliary branch goes to, all of that. Then you have the F branch, the frontal branch. So that just branches into 2, the supraorbital and the supratrochlear. And those supply the bridge of the nose, the upper eyelids, the forehead, and the central part of the anterior 2/3 of the scalp. And then the last branch is the lacrimal branch, the most lateral, and it just goes to it's called the lacrimal nerve. So it goes to the lacrimal gland, conjunctiva, skin at the lateral orbit margin. And all three of those 3 branches and all the terminals off of that make up the entire V1. And it makes sense because when you think about the way that it's supplied on the face, that picture of the face with what V1, V2, and V3 innervate, all the things that those are innervating are in that little V1 section that goes from the middle of the forehead all the way down to the nose, and then on the eyes, and on top, and just right on the sides of the eyes. Now, V2, the maxillary. So similarly to V1, right before it gets to where it's going at first, it gives off a medial meningeal nerve. So the V1 gives off recurrent meningeal, V2 gives off medial meningeal. That goes to dura. It goes to dura. Then it gets to the foramen rotundum. Once it goes into the foramen rotundum, we're now in the zone of the pterygopalatine fossa, which you know is familiar because the pterygopalatine ganglion is here and actually attached to the V2 maxillary nerve. But as we know, cranial nerve 7, the facial nerve, uses it. So you go to the foramen rotundum. The first thing that happens is 5 branches get put off like around the same time. These branches are all sensory, as we said. V2 is all sensory. It goes to the nasopalatine, greater palatine, lesser palatine, posterior, superior, lateral nasal, Y on earth, PSL, pumpkin spice latte, posterior, superior, lateral nasal, and pharyngeal. So the way that you can remember all those nerves coming off right after the foramen rotundum and before you get to the inferior orbital fissure is the mnemonic NGLPP. So not gonna lie, please pass me is in parentheses. So that's all of those. And that's going to be innervating the nasopharynx, the nasal cavity, sphenoid sinus, ethmoidal air cells, and the hard and soft palate. Then you go through the inferior orbital fissure. And as you do, you're giving off a zygomatic nerve branch, just one little standalone zygomatic nerve branch that goes to the anterior zygomatic and the anterior temporal region. Then you have, in the order of posterior, middle, and anterior, you're giving off posterior, middle, and anterior superior alveolar nerves, which makes sense because superior above alveolar is the teeth part of the maxilla and mandible. So you're talking about the upper teeth area. Those three nerves create the superior dental plexus, which also makes sense. And when you think about what that's giving sensation to, it's the maxillary sinus in the maxilla, the upper teeth, and the gums. So that checks out. That's all between the inferior orbital fissure and coming out of the skull, the inferior orbital foramen. The only thing that goes through there is the infraorbital nerves, and that you saw on the outside of the skull in lab. And what that is left to supply is the inferior eyelid, the lateral nose, the cheekbone, and the anterior temporal fossa, which also, as we say, bringing it back to the face makes sense because after view 1, which has that first middle part of the face to the nose and to like the whole eye, right there at the bottom of the eye, as well as on either side of the middle of that forehead, going all the way down, following the contour of your cheeks to the top lip, that is where V2 supplies. Now let's move on to V3. As we know, the V3, the mandibular branch, goes through the foramen ovale. But what happens after that? It goes through there, and now it has entered the infratemporal fossa. That makes sense. That's where the fossa is. The foramen ovale is right above it, so you go down into it. The first thing you give off, just to heads up, 2 branches before things get weird. First, it gives off the spinous nerve, which goes up and out through the foramen spinosum, which, if you'll recall, is also where the, middle meningeal artery goes up and out as well. So the spinous nerve follows that middle meningeal artery through the foramen spinosum. That's the first branch that V3 gives off. Just below that, you're going to get a branch that has sensory and motor components. Oh, let me back up. The spinous nerve supplies the lateral part of the dura and the lining of the mastoid air cells. Sensory. Then you go down and you give off that second branch, the medial pterygoid nerve. That is sensory and motor. Its medial pterygoid is helping with mastication, and then it's got 2 branches, the tensor veli palatini and the tensor tympani. And then once those 2 branches happen, then you go down a little bit more and you're going to get into the anterior and the posterior division. So the anterior division isn't too bad. Obviously it's anterior. And the 2 branches that go through there, it's supposed to be mostly motor. The exception is the buccal nerve branch, which is completely sensory. So the anterior division is the buccal branch, which does the cheek mucosa and adjacent gingiva of sensory. And then it gives off 3 different branches that I've just drawn like a pitchfork to where it's just one line. And then it breaks off for motor innervation of the masseter, the temporalis, and the lateral pterygoid. And so that's just the motor. And that's the whole anterior division. The buccal, and then the masseter, temporalis, and lateral pterygoid motor. Then you break off and you create a posterior division, which is kind of made of the inferior alveolar nerve. And we've already seen the superior alveolar nerves creating that dental plexus from V2. Now this is down in V3. Here's where the posterior comes in, or the inferior comes in. So the posterior division, the first thing that comes off is the auriculotemporal nerves that actually come off as 2 little branches, go around the middle meningeal artery and encircle it, and then connect back together and continue on. And those auriculotemporal are sensory branches that go to the parotid gland, the temporomandibular joint, the external acoustic meatus, the external surface of the tympanic membrane, and the superior temporal region. So that's the auriculotemporal. Then you go down and there's kind of 3 things left. The first thing is pretty simple. It's right after that, it's the lingual. This is all in the posterior division. You have that lingual branch, which, if you'll recall, is what the submandibular ganglion that cranial nerve 7 uses is actually attached to that lingual nerve. It doesn't use it, but that's attached to lingual nerve. And that lingual nerve goes and provides general sensation to the anterior 2/3 of the tongue. And if you'll remember, the chorda tympani of the facial nerve is what provides the taste to that same place. So lingual does general sensation, anterior 2/3, and also does secretomotor function of the mandibular and sublingual glands. So there's that. Then right below from that, after the lingual nerve branch, you have the mylohyoid branch. And that kind of is similar to me as those two little motor branches coming off of the facial nerve that go to the posterior digastric and the stylohyoid. Very similar, because this goes to the mylohyoid and the anterior digastric. The mylohyoid is completely motor, it's the deep mandible. And then the anterior digastric is sensory and motor to the anterior belly of the digastric. Now, so first, this posterior division, you've had the auriculotemporal go around the artery, then you've had the lingual, then you've had the mylohyoid. Now all that's left is that inferior alveolar nerve to continue and go through the mandibular foramen and go through the mental foramen, because it's going up and out, like it's going, or down and out. It's going through the mandibular, through the mental foramen, and becomes the mental nerve that you saw in lab. That's actually, I think, covered by the depressor anguli oris, and it supplies sensation to the skin of the chin, the lower lip, and the adjacent mucosa. And then to back it up a little bit, that inferior alveolar nerve that's going through those two foramen gives off branches to help sensing of the mandibular teeth and gums, inferior alveolar. That makes sense, because the lower teeth region, mandibular teeth and gums, lower jaw, and the adjacent mucous membranes and the skin of the chin. And if you take all that together, you remember that face picture, V3 is showing the sides of that forehead, the very sides of the temple, the bottom jaw part of the cheek, and the bottom of the chin and the mouth. And all the things that we just mentioned was that. So that is the course of the trigeminal nerve